Victorians are this morning bracing for a probable extension to the state's 7-day lockdown amid concerns the COVID outbreak may spread now across the border into New South Wales. Victorian Cabinet ministers and health officials met into the night to talk about the future of the lockdown. It is scheduled to end at midnight tomorrow. The state's cluster grew to 54 cases. 3 were added yesterday, including a man who worryingly appears to have caught the virus from fleeting contact with someone who was positive.
So it all comes as parts of southern New South Wales are also on high alert today after a confirmed COVID-19 case from Melbourne travelled to Jervis Bay and Goulburn while potentially infectious 10 days ago. We'll get more on that developing story a little bit later this hour, but first Steph Ferrier is in Melbourne for us today. So Steph, the state government meeting late into the night, considering the prospect of a longer lockdown.
Yes, good morning, Mads. We as Victorians were all hoping that we were entering the second last day of this lockdown, but now it's looking as if this could drag on for even longer. As you mentioned, those top officials were locked in talks, just discussing options for an extension to this lockdown because they are deeply worried about this rampant Indian strain that appears to infect people just through fleeting contact. Now, we heard from Professor Brett Sutton, the state's Chief Health Officer, last night as well, and he says that this is moving at a really fast pace, and in fact this is one of the biggest challenges they've had so far in a largely unvaccinated population, and he says that they are now being forced to re-examine more than 300 exposure sites in light of this contagious spread. Now, he has said that if this strain is allowed to continue and circulate unchecked as it has in other countries, then many people will die. So that's definitely very strong language, which tends to suggest that they might be softening us for a blow and a potential announcement at some stage today. But yesterday, Martin Foley, the state's health minister, was asked whether or not this extension would happen. He said at that stage he didn't know, and that they were only confident as far as the last piece of data and the last case number because this outbreak is so unpredictable.
It continues to be a day-by-day, case-by-case proposition. We are finely balanced. This is a significant and very concerning outbreak.
And those exposure sites have now increased to 351.
So let's just talk about that, Steph, because it's not just the number of the exposure sites, it's the fact that we're being warned that this variant is just so rapidly transmitting through really casual, fleeting contact.
Yes, that's right. It's something that Jerome Weimar, who is the state's testing and COVID response commander for the Department of Health, really highlighted yesterday. He said that this was an outbreak that has morphed 3 or 4 times in the space of 8 days. And in fact, we are seeing this really fleeting contact. So much so that one of the 3 new cases that we saw yesterday was a man who lives near Stratton Finance, which is one of those outbreak sites, but had not actually gone to any of these exposure sites. And so he is saying that really you can just simply brush past someone on the street and potentially get it. To that end, they are looking at several of Melbourne's popular shopping strips and asking people to just come along and get tested if they've been there in the past week or 2. No longer are they specifying particular dates or times because of this situation that we now have with this fleeting contact. Let's have a listen to what he had to say.
This is stranger to stranger transmission. What we're seeing now clearly is people who are, they're brushing past each other in a small shop. They're going around a display home. They're looking at phones in a Telstra shop. This is relatively fleeting contact. They don't know each other's names. And that's very different from where we've been before.
Very different and quite worrying. Jerome Weimar there. Steph, thank you very much. Now, parts of southern New South Wales are also on high alert today after a confirmed COVID-19 case from Melbourne travelled while potentially infectious 10 days ago. Authorities have issued a public health alert after the case visited a number of venues in the Goulburn, Jervis Bay and Hyams Beach areas on the 23rd and the 24th of May.
Nursing home and disability sector workers will be able to take priority at Victorian vaccine hubs from today. The 5-day immunisation blitz was announced after a nursing home resident and 2 workers tested positive to COVID. Workers will be fast-tracked to 10 state government-run hubs.
Western Australian authorities are urgently investigating how a returned traveller acquired COVID-19 while in hotel quarantine in Perth. Genomic sequencing has confirmed the virus was transmitted from an infected guest to another in a neighbouring room in the Pan Pacific Hotel. 12 guests on the same floor and staff members have all been retested with negative results. The Health Department says the cause of the transmission is not yet known, and it comes after a COVID scare linked to a ship docked south of Perth, with a crew member returning a negative test yesterday after originally testing positive.